Hi everyone, today we are talking about the restrictive and repetitive interests that show up in Autism Spectrum Disorder. I am Dr. Leslie Blevins and I'm with Enilda Clinic at enildaclinic.com. So let's get started. First, keep in mind that today's video is only for educational purposes. If you have any specific concerns about yourself or about your child, please make sure that you reach out to the appropriate physician. Okay. So restrictive and repetitive behaviors are one of two domains that occur inside the symptomology of autism spectrum disorder. The other set of symptoms are essentially social communication difficulties, and we're not going to cover those today. We're going to focus on restrictive and repetitive behaviors. And so these are essentially a lack of flexibility and a repetition of behavior that leads to a lack of variety in behavior for the individual, and also a limitation for that individual to have access to varied interests, varied activities, and access to varied environments. And so what I want to do is kind of look through the different criteria that are in our DSM-5, which is the Diagnostic and Statistical Manual that we use here in the US. I have the current edition, which is the 5th edition, and just kind of talk about what do these criteria look like. And I'm going to specifically focus on higher functioning individuals, so people who we would think of as high functioning, as having high functioning autism, or I know previously, before this edition of the DSM, we would refer to that condition as Aspergers, and many times individuals still think of themselves as having Aspergers whenever they have high functioning autism, and so oftentimes we can use those two terms interchangeably. So I just kind of want to read through here and talk about what it would look like in a higher functioning individual. So the first one is stereotyped and repetitive motor movements, use of objects or speech. And so they give some examples. So they give simple motor stereotypies, lining up toys or flipping objects, echolalia, and idiosyncratic phrases. And so you can think of this as being something that's pretty easy to witness. This one might actually be the one that for a higher functioning individual would show up in their toddler and preschool years, but it might fade away as the individual is growing up and just becoming more advanced in the types of activities they're interested in. However, if an individual is under pretty stressful circumstances, they might go back to doing these types of behaviors. And so you can also think about how they might just organize their day-to-day environment at home, and how they organize their speech, how they respond to social interaction. So whenever you're communicating with that person, if they lack a variety of phrases that they use to interact with you, then that could also be a version of restriction. In children, I think it's the easiest to identify because you can really start to see more of the repetitious behavior through how they engage with their toys. They tend to show more rigidity and upset if somebody tries to engage with the toys in a way that they don't like. And you can see it through a lack of interest in a variety of toys as well. And so that's how I see it there. So the second criteria, insistence on sameness, inflexible adherence to routines, and ritualized patterns of verbal and nonverbal behavior. And so you can think of this as occurring with difficulties with transitions. And so sometimes we see with individuals with autism that they might have a difficulty transitioning from one activity to another activity. So just moving from one area of the home to another area of the home, or one classroom to another area of the school. So transitions can be difficult, or even having a different teacher that day than who they normally have, or a different routine from what they expect their schedule to be, those types of changes can be particularly upsetting. And, granted, every child, we always train parents to develop routine for children because children tend to benefit from that. It helps them to learn how to predict their world. But the difference here is that a child with autism tends to have a bigger adverse response to changes in routine. They tend to not recover quite as easily as the typical child, and it tends to set them up to where they can't engage in their environment whenever they do encounter that change. You can also notice it with the way that they are interacting with you verbally. And so they might have a particular way that they engage with you or with others that they're inflexible in doing. So they might have certain social routines, like they always say hi in a very particular way, like the very first way that they learned how to say hi or to greet somebody, or they might always say bye in a very particular way. They might have a script for birthdays that are very particular and they cannot deviate from that script. And other types of social routines that are very rigid and don't allow for flexibility that would naturally occur across someone's life and that most children or individuals would allow for. Okay, so now let's go to the next one. A highly restricted, fixated interest that are abnormal in intensity and focus. And so for this one, I often hear parents describe that their child has a strong interest in some sort of topic like the Titanic or with trains or something else, and the duration of that topic can last for a very long time. It might last for months or a couple of years. It might last even longer than that. And then also the intensity of the child's interest is one that's intrusive to that child having social opportunities. So if the kid wanted to go talk to another kid on the playground, the only thing that the child wants to talk about is their restricted interest. Let's say, for instance, trains. If that's the restricted interest, then the child could only engage with other children if those other children also had an interest in talking about trains. But when the other children wanted to switch topics and talk about something different, then the child who has autism might not be able to be flexible and talk about those other interests. They might actually try to keep bringing the conversation back to trains, or they might get frustrated and they might refuse to talk to the children whenever they aren't engaging in a train topic. And so we see that restricted interest can be about verbal things as well. Now, of course, we also hear about people who have high functioning autism who, as they get older, they utilize their strong restricted interest to actually build some expertise in topics. And so sometimes that can be formed into a career interest. And so it isn't to say that it doesn't have certain beneficial aspects, but as far as being younger or being in the social world, it might be limiting as far as experiencing a range of environments and a range of opportunities because the interest might not be there to do so. Okay, and then the last criteria under restricted and repetitive behaviors is having a hyper or hyporeactivity to sensory input or unusual interest in sensory aspects of response to specific sounds or textures, excessive smelling or touching of objects, visual fascination with lights or movement. And so with this one, what we often see is that the child or the individual will be particularly sensitive to lights or to sounds or to smells, to the textures of food or the textures of clothing. So think about all 5 senses. And so maybe the family has learned to limit certain varieties of sensations. So maybe they cut the tags out of clothing, or maybe they limit the types of foods that are given to the child, or they make sure the volume of the TV and the radio is turned down, or they limit how loud they speak. And the types of environments that might be chaotic are limited for the child to have access to. And so in those ways, sensory sensitivity is supported. And then you can also have hyposensitivity. I often hear about this one, especially in relation to pain, where the child just doesn't particularly tell the parent about pain. And so the child might have a strong fever and actually be vomiting, but in no way has the child indicated that they're sick until they're actually vomiting, and the parent is like, whoa, and they measure their temperature and they're like, okay, you were super sick. How did you not feel bad before this very moment and not tell me this? And there might be a history of little things like that where the parent's like, I just don't think that they really feel pain to the degree of maybe my other kids or other children I know of. And so in that way, there might be more of a hyposensitivity. Sometimes you can see sensory variations of hyper and hypo through the way that the person interacts with their environment. And so you can actually see visual sensitivity with the way that the person looks at an object. They might enjoy or prefer having looking at an object through the corner of their vision, or they might look at other objects in ways that we don't typically see people looking at objects. So just kind of getting down at a level, looking at things really close up, things like that. And maybe repetitively smelling different things. So being, highly interested in the smells of different objects, things like that. And so these are the ways that we can see restrictive and repetitive interest come into play. The interesting thing about autism spectrum disorder is that restrictive and repetitive behaviors and interest do not need to currently be present in order to have a diagnosis of autism spectrum disorder to be rendered. You can have a history of restrictive and repetitive behaviors, but that would be sufficient in order to get the diagnosis, as long as you met all the other criteria as well. And so with most disorders inside the DSM, you need to have currently all of the criteria that are required in order to have that diagnosis rendered. But with autism, you have to have the social impairments currently, but the restrictive and repetitive behaviors you can have currently or just a history of them. And I think that with a lot of the people who have higher functioning features of autism, many times those restrictive repetitive behaviors are much clearer whenever the child is young, but as they get older, they actually either find more adaptive ways to integrate with their environment to where they aren't doing the restrictive repetitive behaviors, or they are masking the need and urge to do the restrictive and repetitive behaviors, or they are integrating that need to do it into a very socially adaptive skill set, like having a career focus and becoming an expert. And so, or even if their, restrictive repetitive interest is something that's socially popular for the moment. And so you can imagine that if a kid really loved Pokemon Go, whenever Pokemon Go was really popular, then that kid would probably have a lot to talk about with the kids around them. And so, so those are all the restrictive repetitive behaviors and interest the criteria for them. I hope that you enjoyed this video. You can see more learning videos at enildaclinic.com, and you can sign up for learning videos there to receive these videos in your email. Okay, I'll see you next time.